In this video, we will talk about why onions, despite their reputation as a superfood, can be extremely dangerous for certain people. We will take a detailed look at which health conditions make eating onions inadvisable and why ignoring this information can seriously harm your health and in some cases even put your life in danger. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like and let's get started. 1. Avoid onions if you have severe heart conditions, a history of stroke, problems with blood clotting, or low blood pressure. Onions are known for their vasodilating and blood-thinning properties due to their high content of flavonoids, especially quercetin and sulfur-containing compounds. These substances can be beneficial for a healthy body, but for people with serious cardiovascular issues, their effects can become dangerous. When large amounts of onions are consumed, the blood vessels widen, blood pressure drops, and the blood becomes less viscous. For someone with chronic heart failure or coronary artery disease, such a sharp drop in blood pressure can reduce blood flow to the brain, causing fainting, loss of consciousness, and even leading to a stroke. Onions are especially risky for individuals with blood clotting disorders, including those taking anticoagulants after a heart attack or stroke. Reduced blood clotting increases the risk of internal bleeding in the gastrointestinal tract, brain, or other organs. Even minor damage to a blood vessel in the context of impaired hemostasis can lead to serious complications. This is why people with severe heart diseases, a past stroke, blood clotting problems, or chronic low blood pressure should be extremely cautious with onion consumption, especially in raw form, where its active compounds are most concentrated. 2. Avoid onions if you have chronic obstructive pulmonary disease or frequently suffer from severe respiratory infections. For people with chronic respiratory conditions, especially chronic obstructive pulmonary disease, any additional irritation of the mucous membranes can pose a serious threat. Onions, due to their high content of essential oils and active sulfur-containing compounds, can increase irritation in the airways. When consumed, they can stimulate mucus production in the bronchi and trigger bronchospasm, which is a sudden narrowing of the airways. For individuals with chronic obstructive pulmonary disease and weakened lungs, this can lead to intense coughing fits, shortness of breath, a feeling of air hunger, and a decrease in blood oxygen levels. In the presence of existing breathing problems, even a mild episode of bronchospasm can worsen overall health, require emergency medical attention, and raise the risk of hospitalization. In cases of frequent severe lung infections, such as pneumonia or bronchitis, additional irritating factors, including components found in onions, can interfere with recovery and contribute to the chronic progression of inflammation. This is why doctors recommend avoiding raw onions in the diet of people with respiratory conditions, limiting their intake, and closely monitoring any changes in well-being after eating. Avoid onions if you've been diagnosed with cancer. When someone is dealing with cancer, the body is already under extreme strain. The immune system is weakened, the digestive system is impaired, and metabolic processes are significantly disrupted. Onions, due to their high concentration of essential oils, active enzymes, and sulfur-containing compounds, can irritate the lining of the stomach and intestines, intensify inflammation, and trigger spasms. This is especially dangerous for people whose malignant tumors are located in the digestive organs, such as the stomach, intestines, liver, or pancreas. Even a small amount of raw onion can increase nausea, cause abdominal pain, worsen appetite, and lead to rapid weight loss. In addition, onions place extra strain on the liver, which in cancer patients is often already affected by the toxic impact of chemotherapy or metastases. Medical observations show that in cancer patients, regular consumption of foods that irritate the gastrointestinal tract increases the risk of ulcer complications, internal bleeding, and severe toxic overload in the body. That is why, in the case of any cancer diagnosis, onion consumption should be strictly limited or completely avoided, especially in raw form. 4. Avoid onions if you have type 2 diabetes, obesity, or metabolic syndrome. Type 2 diabetes, metabolic syndrome, and obesity are conditions associated with impaired carbohydrate metabolism, where the body loses its ability to properly regulate blood sugar and insulin levels. Onions, especially when consumed in large amounts, can stimulate insulin release by triggering certain biochemical reactions in the body. At first glance, this may seem helpful, but for people with insulin resistance or unstable diabetes, such a release can lead to dangerous consequences. Blood sugar levels drop sharply at first, causing weakness, dizziness, trembling, and strong cravings for sweets. This is followed by a compensatory spike in blood sugar, which increases the load on the pancreas and further worsens metabolic function. In addition, onions can stimulate appetite and cravings for carbohydrates, which makes it harder to control body weight. For people with metabolic syndrome, this often leads to dietary breakdowns, overeating, and weight gain. Especially problematic are dishes where onions are used in fried or caramelized form, since they have a high glycemic load. That is why people with type 2 diabetes, obesity, or metabolic syndrome are advised to limit their intake of onions, particularly raw onions or large quantities, in order to avoid blood sugar spikes, hypoglycemia episodes, and difficulties in managing weight. 5. Avoid onions if you have developed Alzheimer's disease or other forms of dementia. Alzheimer's disease and other types of dementia are accompanied by serious impairments in brain function, including reduced memory, attention, and logical thinking. In such conditions, the body becomes especially vulnerable to any internal fluctuations, including changes in blood sugar levels and blood pressure. Onions, due to their active compounds, can dilate blood vessels and affect glucose metabolism. In elderly individuals with dementia, this may cause sudden shifts in blood pressure, both increases and dangerously low drops. Additionally, the way onions stimulate insulin production can lead to instability in blood sugar levels, which is extremely risky for the brain, especially when it is already experiencing an energy deficit. Clinical observations show that fluctuations in blood sugar and blood pressure in patients with dementia worsen short-term memory, increase disorientation and irritability, and raise the risk of falls. In more severe cases, vascular complications may accelerate disease progression and even trigger a stroke. This is why in Alzheimer's disease and other forms of dementia, it is important to avoid foods that can destabilize metabolic and vascular systems, such as onions, especially in raw form. 6. Avoid onions if you are in an advanced stage of chronic kidney disease. The kidneys are the primary organs responsible for removing excess potassium from the bloodstream. In advanced stages of chronic kidney disease, their filtration ability is significantly reduced, and even a small amount of potassium from food can become critical. Although onions are considered a healthy vegetable, they contain a relatively high concentration of potassium, about 146 milligrams per 100 grams of product. For a healthy person, this amount is not harmful. However, for someone with severe kidney failure, eating even a couple of servings of salad with onions can lead to hyperkalemia, a dangerous condition where potassium levels in the blood rise to life-threatening levels. Hyperkalemia disrupts the electrical activity of the heart, leading to arrhythmia, rapid heartbeat, weakness, dizziness, and in severe cases, cardiac arrest. According to medical research, even a single episode of excessive potassium intake in dialysis patients increases the risk of life-threatening complications within the next 24 hours. This is why people with chronic kidney disease must strictly monitor their potassium intake by limiting foods such as raw and cooked onions, and they should consult a nephrologist regarding their diet. 7. Avoid onions if you have cirrhosis of the liver or severe chronic liver disease. Cirrhosis is a condition in which healthy liver cells are replaced by scar tissue, disrupting the normal functioning of the organ. Even mild stimulation of the liver in this state can lead to serious consequences. Onions, due to their active biochemical properties, stimulate bile production and increase metabolic activity in liver tissue. For a healthy person, this may be beneficial, but for a diseased liver, it becomes an additional burden. In cirrhosis, every attempt by the liver to work more actively leads to further damage to its structure. In addition, increased bile production caused by onions can trigger bile stagnation in damaged ducts, contributing to inflammation and worsening the condition. Clinical observations show that patients with cirrhosis who consume foods that stimulate liver activity are 28% more likely to develop complications such as ascites, portal hypertension, and hepatic encephalopathy. This is why people with cirrhosis or severe chronic liver conditions must eliminate foods that overload the liver, including onions in any form, whether raw or fried. 8. Avoid onions if you have gastritis, stomach ulcers, or irritable bowel syndrome. The lining of the stomach and intestines serves as a barrier that protects the internal organs from aggressive external factors. In cases of gastritis, peptic ulcers, or irritable bowel syndrome, this barrier is damaged or inflamed, and any irritating substance can cause a sudden worsening of symptoms. Onions contain a large amount of essential oils, organic acids, and sulfur-containing compounds that irritate already inflamed tissues. When eating raw onions or dishes that contain a high amount of them, people often experience sharp pain in the upper abdominal area, heartburn, a feeling of heaviness, bloating, and even nausea. Research shows that in individuals with gastritis or ulcers, the frequency of flare-ups increases by 30 to 40% with regular consumption of raw or fried onions. In severe cases, bleeding from damaged areas of the mucosa may occur, requiring urgent medical attention. Onions are especially dangerous during the acute phase of these conditions when the lining of the digestive tract is most vulnerable. That is why people with gastritis, ulcers, or irritable bowel syndrome are advised to completely eliminate raw onions from their diet and be cautious even with cooked onions after consulting with a gastroenterologist. 9. Avoid onions if you have chronic pancreatitis or other pancreatic diseases. The pancreas is one of the most sensitive organs in the body, especially reactive to digestive stimulants. In chronic pancreatitis, the tissues of the pancreas are inflamed and weakened, and its enzymatic activity can become uncontrollable. Onions, especially in raw or fried form, strongly stimulate the production of digestive enzymes. This happens due to organic sulfur-containing compounds that irritate mucous membranes and activate the digestive system. In a healthy body, enzymes are released to break down food, but in pancreatitis, the enzymes begin to digest the pancreatic tissue itself. As a result, a severe flare-up may occur: intense pain in the upper abdomen, vomiting, bloating, and disruption of digestion. According to the American Gastroenterological Association, more than 40% of patients with chronic pancreatitis experienced flare-ups triggered by foods that strain the pancreas, including onions. This is why people with chronic pancreatic conditions are advised to completely eliminate raw and fried onions from their diet, and even boiled onions should be consumed only in minimal amounts and only after consulting a doctor. 10. Avoid onions if you have been diagnosed with gallstone disease. The gallbladder is a small reservoir where bile is stored, which is essential for digesting fats. In gallstone disease, stones form in the gallbladder and may remain unnoticed for a long time until something triggers their movement. Onions have a strong choleretic effect. Their bioactive compounds stimulate gallbladder contractions and promote the release of bile. If stones are present in the gallbladder, their movement triggered by onions can lead to blockage of the bile duct. This causes sharp, intense pain in the upper right abdomen that may radiate to the back or shoulder, a gallbladder colic attack. Such conditions often require emergency hospitalization and, in some cases, immediate surgery to remove the gallbladder. Medical statistics confirm that in patients with gallstone disease, the risk of an attack increases by 35% after consuming foods that stimulate bile production, such as onions. This is why people with gallstones must strictly avoid foods that intensify gallbladder contractions, including onions, in order to prevent acute complications and protect their health. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.